Welcome to another session. In this session, we are going to learn about nerve injury and the classification of nerve injury, degeneration and regeneration, which occurs in the nerve fiber. Nerve injury, usually the common causes of nerve injury is trauma and fracture of long bones, which may be because of crush injury, or there are many other causes, which is like there may be obstruction in the blood flow, which may cause ischemia or hypoxia, and that may cause nerve injury. And even when there is injection of local toxins, or if there is a transaction through the nerve, which may be the through and through cut injury, it may be the cause for nerve injury. So all these are some of the causes of nerve injury. So the common causes are crush injury, obstruction of blood flow, injection of local toxins, or it may be because of transaction through cut injury. So all these are the common causes of nerve injury. During nerve injury, the most common part to be injured in the nerve is axon. So in the previous class we have studied the axons are the structures which is forming the nerve. So mostly peripheral nerve gets injured, whereas when there is a nerve injury, this does not kills the cell body of the neurons. Most of the times the injured nerve undergoes repairing process, and that process is called regeneration. Before that, nerve undergoes, when there is a nerve injury, immediately the first changes which occurs in the nerve cell body and the axon, and those changes are considered as the degenerative changes. So first there will be degeneration following nerve injury, then there will be repair of the injured tissue. So that is called regeneration. So we will study detailedly, and we can classify nerve injury based on two classifications. One is Sunderland classification, the other one is equivalent Sedan classification. So based on Sunderland classification, the nerve injury is classified from 1st to 5th degree. So 1st degree, 2nd degree, 3rd degree, 4th and 5th degrees. And in equivalent Sedan's classification, there are three terms. The 1st degree is also called as neuroproxia in equivalent Sedan classification. In 2nd degree, it is termed as oxynotomosis. In 3rd degree, it is termed as neurotomosis. So this neuroproxia, it is the most common type. So the 1st degree is the most common type because it occurs mostly when there is a pressure which is applied for a nerve for a prolonged time. So because of this, there may be a compression. When there is a prolonged pressure, compression in the nerve, this leads to ischemia, which may cause mild demyelination in the nerve, but there will be no disturbance in the nerve continuity. Nerve will be in continuity. Because of mild demyelination, there will be conduction block, which may be local conduction block, and because there is only mild demyelination, the spontaneous recovery is possible, which occurs within minutes. And in this type of nerve injury, best prognosis is possible. So this is 1st degree. So 1st degree, it is the most common type. Nerve will be in continuity. Mild demyelination occurs because when there is prolonged pressure which is applied, which may cause ischemia. And because of mild demyelination, there will be only mild or local conduction block, and spontaneous recovery is possible in this type of nerve injury, and best prognosis is possible in 1st degree injury. In 2nd degree classification, that is in oxynotomosis, there will be injury to axon and encapsulating structures. Like we have seen when we studied about the nerve, I told you there are three layers where the single nerve fiber is surrounded by endoneurium, which is the innermost layer, then group of nerve fibers which forms fasciculae, and each fasciculae is surrounded by a nerve the covering which is called as perineurium, and the all the fasciculae together forms nerve that is surrounded by again a connective tissue which is called as epineurium. So endoneurium, perineurium and epineurium, all these three layers will be intact when there is 2nd degree type of nerve injury. So this type of nerve injury is called as oxynotomosis, where there is only injury to the axon, all the encapsulating structures are intact. And in this type of nerve injury, Wallerian degeneration occurs. What is meant by Wallerian degeneration? The degenerative changes which occurs distal to the site of injury. Those changes are called as Wallerian degeneration, which we will study detailedly in the next few slides. And the rate of recovery at this type of nerve injury is 1 to 3 millimeters per day. In 3rd degree nerve injury, that is in neurotomosis, here also the injury to the axon occurs, but whereas you can see the endoneurium will be disrupted, whereas epi and perineurium will be intact. Here also Wallerian degeneration occurs, but here because endoneurium is disrupted, the recovery will be very much slow and it may be poor or sometimes it may be incomplete recovery. The regeneration is not, complete regeneration is not possible in this type of nerve injury. And when we come to the fourth degree, it is the fourth and fifth degree, those are also called as neurotomosis in equal and Sedan classification. In fourth degree, again, it is a severe form of injury to the axon. Here, endoneurium and perineurium both are disrupted, only epineurium is intact. Here also Wallerian degeneration occurs. This requires surgery for recovery because both endoneurium and perineurium are disrupted. In fifth degree, it is also a severe form of injury to the axon. All the three encapsulating layers are disrupted. Wallerian degeneration occurs. Here also it requires surgery. So fourth and fifth degree is almost same. It is a severe form of injury to the axon. In fourth degree, only two layers, endoneurium and perineurium are disrupted, whereas epineurium will be intact. In fifth degree, all the three layers will be disrupted. So here we can see a picture which shows all the nerve injuries, different types of nerve injuries. Here we can see grade 1, which is neuroproxia, grade 2, which is axonottomosis, grade 3, grade 4, grade 5, all the three are called as neurotomosis, right? So these are the Sunderland classification, which is grade 1 to grade 5, and Sedan's classification, which is neuroproxia, axonottomosis and neurotomosis. In neuroproxia, only there is mild demyelination occurs, whereas the nerve will be in continuity. All the encapsulating layers will be intact. You know this, right? So this is the most common type. Neuroproxia is the most commonest type. Only because there is mild demyelination, the prognosis is possible and spontaneous recovery occurs within a minutes. In grade 2, that is in axonottomosis, you can see the axis cylinder is disrupted, whereas all the three layers are intact. All the three layers are intact. So that is grade 2. The axon, there is an injury to the axon here. There is an injury to the axon. So this is grade 2. In grade 3, you can see that this is endoneurium. So here you can see this is the endoneurium, this is perineurium, and this is epineurium. And here you can see that. So here you can see in this picture you can see. So this layer is endoneurium, which is the immediately the axon, immediately surrounding the axon there is endoneurium. Outer to that there is perineurium. The outermost layer is the epineurium. So here you can see the endoneurium is disrupted. In third degree, the endoneurium is disrupted. So in this type of nerve injury, recovery is incomplete and it may be poor recovery. And in fourth degree, the endoneurium and perineurium both are disrupted, whereas in fifth degree, all the three layers are disrupted where the nerve continuity is not there. So these two grades of nerve injury requires surgery. So regeneration is not possible in this type of nerve injury. So this is about nerve injury. Now we'll move on to the degeneration and regeneration. So degeneration, what is the meaning for degeneration? It is nothing but deterioration or impairment or pathological changes of an injured tissue. So this degenerative changes occurs both in the nerve cell body as well as in the nerve axon, and this occur in the same neuron, the neuron which is get injured and the neuron which is adjoined, or the neuron which is synapsed with the injured neuron. So these changes are called as degenerative changes. So here you can see this is the site of nerve injury, and distal to the site of injury there are some changes which occurs, degenerative changes, and even proximal to the site of injury degenerative changes occurs. So based on this, these degenerative changes are classified as Wallerian degeneration, retrograde degeneration, and transneuronal degeneration. What is meant by Wallerian degeneration? It is also called as anterograde degeneration, where distal to the site of injury, the degenerative changes which occurs is called as Wallerian degeneration, and the degenerative changes which occurs proximal to the site of injury is called as retrograde degeneration. What is meant by transneuronal degeneration? The degenerative changes will also occur in the neuron which is joined with this injured neuron. That is, the neuron which is synapses with this neuron will also show some degenerative changes. So that type of degeneration is called as transneuronal degeneration, where we can see one example that when we take a injury to the optic nerve, we can also see chromatolysis, which is a change which occurs in the cell body. So chromatolysis is also seen in the lateral geniculate body, which is where the neurons get synapses with the neurons of the optic nerve. So when there is injury to the optic nerve, the chromatolysis, that is degenerative changes, also seen in the lateral geniculate body. So that is example for transneuronal degeneration. So first we'll see what is Wallerian degeneration. So Wallerian degeneration, I told you, it is also called as anterograde degeneration, or it is distal degeneration. So degenerative changes which occurs distal to the site of injury. So that is the degeneration which is called as Wallerian degeneration. It is named because it was discovered by a scientist who is called Augustus Waller, and hence it is named as Wallerian degeneration. These changes begins within 24 to 36 hours after injury. So within a day, these Wallerian degenerative changes occurs distal to the site of injury. What is the first change which occurs in Wallerian degeneration? So the axis cylinder will swell up and it will break down into small fragments, and this forms a debris which is collected within the axis cylinder. So this is the first change which occurs. So axonal degeneration is the earliest to occur. Following this, myelin sheath will also disintegrate, and myelin sheath is a lipid protein complex. Mainly lipid is the major component. So 80:20, that is the percentage, that is the ratio of lipid protein complex in the myelin sheath. So because this myelin sheath disintegrates, the fat droplets also occupy the axis cylinder. So these two, that is the debris which is formed by the disintegration of the axis cylinder, as well as the myelin sheath disintegration which forms the fat droplets, both are removed by the macrophages and squam cells, which clear the debris following these two changes. So neurolemma will not be affected, and because these debris is cleared, then this neurolemma remains as a hollow tube. So here you can see the changes which occur. So this is the site of injury. Following the injury, so distal to the site of injury, there are some degenerative changes which occurs. You can see that first there will be the axis cylinder will be filled with the debris, then even the debris will be removed, right? So these are the degenerative changes, and only a hollow tube, that is the neurolemma, will be remain as a hollow tube. So these are the degenerative changes. So the next one is retrograde degeneration, or proximal degeneration. So what we said is Wallerian degeneration. Wallerian degeneration is degenerative changes which occurs distal to the site of injury. So the same changes simultaneously will also occurs proximal to the site of injury. This changes, the same changes will also occur till the first node of Ranvier in the proximal site of the injury. There are some changes even which occurs within the cell body of the neuron. So what are all the changes which occurs in the cell body? There will be collection of fluid within the cell body. Because of that, the cell body will swell up and it will become round, and because of this, nucleus will be pushed to the periphery, and the disintegration and dissolution of Nissl bodies will occur. This forms a fine dust-like Nissl granules, and finally they will disappear, and this process is called chromatolysis, and these changes will occur within 48 hours. We told that Wallerian degeneration occurs within 24 to 36 hours, whereas proximal degeneration it begins within 48 hours and it even continues up to 15 to 20 days, whereas Wallerian degeneration continues up to 3 months. So this nucleus will be pushed to the periphery, and then within the cell body, the Golgi apparatus and mitochondria fragment and disintegrate. So all these are the changes which occurs in the proximal to the site of injury. Here we can see a picture which is showing, I told you, proximal to the site of injury till the first node of Ranvier, the same changes which occurs in the Wallerian degeneration will also occur. What are all the changes we saw in the Wallerian degeneration? So the axis cylinder, what will happen? It will swell and it will broken down into fragments which will form a debris, and the myelin sheath will disintegrate, and that will form fat droplets, and all this debris and the fat droplets will be removed by the macrophages and squam cells. So I told you these changes, and these changes will also occur proximal to the site of injury simultaneously, but this occurs only till the first node of Ranvier. Even in the proximal degeneration, the degenerative changes will also occur in the cell body. So what are all the changes we said? That is, the cell body swells up. You can see this is the normal cell body of the neuron. Here you can see the size is enlarged. So the cell body is size of the cell body, it is swollen and it is filled with fluid. Because of that, the nucleus is pushed to periphery, and you can see the Nissl granules. These Nissl granules disintegrate and they'll appear like a fine dust particles. Finally, they'll disappear, and that process is called chromatolysis. The Golgi apparatus and mitochondria both will also disintegrate. So all these changes are called as degenerative changes which occurs in the proximal site. So proximal degeneration or the retrograde degeneration. So this is about degeneration. Next, within 96 hours of injury, after injury, the regenerative changes will occur. What is mean by regeneration? It is the repair of the injured tissue, that is regeneration. So within 96 hours after injury, the proximal end of the nerve sends sprout to the hollow tubes. We said that neurolemmal tube will remain hollow, but the squam cell will proliferate and they'll fill the neurolemmal tube. Neurolemmal tube will remain as a hollow tube, and this hollow tube will be filled up with this sprouts, and the squam cells which are there in the axis cylinder will emit growth factors, and that will attract these sprouts to the injured site. And this regeneration will occur at a speed of 1 to 3 millimeter per day. But regeneration is a primary function of the proximal term, because only from the proximal end of the nerve the sprouts are growing and it is filling the hollow tube, right? So this is the primary function of regeneration, is the primary function of proximal stump, but it will occur only when there is an intact endoneurial sheath. Endoneurium should be intact. That's why I told you in 4th and 5th degree grades of nerve injury, the regeneration is not possible. It requires surgery because endoneurial tube is not intact. So here you can see the regenerative changes. I told you the neurolemmal, once the degeneration occurs, right? First axis cylinder will be broken down into fragments, debris will be formed, everything will be cleared. That is the Valerian and proximal degeneration up to first node of Raniver, and the neurolemmal tube will remain as a hollow tube. So up to this, the degenerative changes. Next, what will happen in the regeneration? What will happen? You can see these sprouts, right? Up to 50 sprouts will be projecting out from the proximal ends, and these sprouts, you can see that proximal sprouts will go into the hollow tube and they will grow as a nerve. So these are the regenerative changes. So this axis cylinder inside the neurolemmal tube will be fully established within 3 months after injury, and the myelin sheath will also be formed by the squam cells. You know, squam cells are the different types of, it's a type of macroglial cells which is involved in the formation of myelin sheath, and these squam cells, they'll form this myelin sheath, and the myelin sheath completion will be slower and it will take 1 year for the complete myelin sheath formation. And the diameter of the nerve fiber will also gradually increase and it will reach up to 80% of its original diameter. And the newly formed internodes will be shorter than the original the internodal spaces. In the nerve cell body, the changes we said in the nerve cell body, the cell body will swollen up, right? During degeneration, cell body will swollen and nucleus will be pushed to the periphery, and then Nissl granules will disappear and Golgi apparatus and mitochondria, everything will disintegrate. All this will come back. So you can see here the Nissl granules will appear. Following this, the Golgi apparatus will also appear and the cell will lose its excess fluid, so that nucleus will come to its central position. All this anatomical regeneration will occur in the nerve. But even though anatomical regeneration occurs, but functional recovery takes a very long time. So all these are regenerative changes. The regeneration can be tested by a Tinel sign, which is positive, which means what? On tapping the injured nerve, tingling sensation can be felt. So this is called Tinel sign, which is positive, which is an indicator of regeneration. So there are some criteria for neogeneration. I told you as already, only when there is endoneurial tube is intact, the proximal end can send sprouts to the hollow tube and the regeneration is possible. There are some other criteria where you can see gap between the both cut ends should be less than 3 millimeters and the neurolemma should be present, only then the regeneration is possible. And the nucleus must be also intact, only then the regeneration will occur, and two cut ends should be remain in the same line, otherwise regeneration will not occur. So all these are some of the criteria for nerve regeneration. So now we'll come to the MCQ session. Best prognosis in nerve injury is seen in neuroproxia, axonottomosis, neurotomosis, complete transaction. So which will be the answer? The answer is neuroproxia. You know that this is the first degree of injury. So this is the one which is the most common type, and the best prognosis and spontaneous recovery is possible in neuroproxia. The axonottomosis and neurotomosis, in neurotomosis it requires complete surgery, and axonottomosis the recovery may be poor or incomplete, or sometimes it may be very slow. So the most severe form of nerve injury is, what is the most severe form of nerve injury? Yes, it is neurotomosis. You know, the first degree is also called as neuropraxia. Second degree in equal and Sadan classification, it is termed as axonottomosis. Third to fifth degree in equal and Sadan classification, it is termed as neurotomosis. Axotomy is removal of axon. So that is called axotomy. Neuroma. Neuroma is nothing but when the regeneration occurs. I told you there are some criteria for regeneration, right? So the cut end should be in the same line, and the distance between the two cut ends should be less than 3 millimeters. All these are some of the criteria, right? So the cut ends, if they are very far away, what will happen? These sprouts will grow as a mass, and that is called neuroma. And this neuroma is very much painful, and it is one of the very important complication of amputations. And now you try to tell the answer. So neuroma is a cancerous condition of nerve fiber. No, it is not a cancerous condition. Degenerative and regenerative changes in peripheral nerves after injury. No, it is not neuroma. Painful collection of nerve fibers at the site of injury. So yes, this is the answer. So what is neuroma? Neuroma is it's a mass which will have severe pain, and it will be formed when the sprout is not possible to reach the other cut end of the nerve. So it is a painful collection of nerve fibers at the site of injury, an area of anesthesia following sensory damage. No. So first change that occurs in Wallerian degeneration is, which is the first change which occurs in Wallerian degeneration? What is Wallerian degeneration? Wallerian degeneration is the degenerative changes which occurs distal to the site of injury. So what is the first change? Myelin degeneration, axon degeneration, degeneration of neurolemma, macrophages remove debris. Which is the first change which occurs? Yes, it is axon degeneration. I told you, first thing which will happen is axis cylinder will swell, and it will broken down into small fragments which will form debris. Then only following this, myelin will degenerate, and this will form a fat droplets. Both of these debris and fat droplets will be removed by macrophages. That will occur later. The neurolemmal tube, once the debris is formed, the neurolemmal tube will remain as a hollow tube. No degeneration will occur in the neurolemma. Neurolemma is usually unaffected. So which is the answer? Axon degeneration is the answer. Thank you.